In British Columbia, a legal challenge will soon be getting underway that could give Canadians more access to private health care. Yanick Labrie is an economist at the Montreal Economic Institute, which is an independent and not-for-profit research organization. And welcome. So you've done a study on the implications of this legal challenge, but maybe first you can tell me what exactly this legal challenge is about.
This legal challenge is led by the former president of the Canadian Medical Association, Dr. Brian Day, along with a group of patients. Well, it began in 2009. Patients in British Columbia were concerned about the growing waiting list to get access to elective treatment in the hospital sector. So they felt that they had the right, and they should have the right, to decide whether they can buy a private duplicate insurance for medically required services and choose a provider of their own. I mean, if they want to go to a private provider or a public provider, they should
They're basically
be
saying,
allowed
if I can pay for it, then why can't I take care of my own health, right? And I think some of them, unfortunately, have even made their own case because they've died since this thing, because they didn't get the medical care that they needed. Yep. In Quebec, we had the Shaoli decision in 2005 saying that, you know, the ban on private insurance violates the right to life, that it's unconstitutional. But not very much has happened as a result of that either, right?
No. Very few changes emerged from the ruling. We were expecting a lot. You know, we thought that a market for private duplicate insurance would emerge and people would get access to faster access to care in Quebec. But you know, it's the same old story again and again. And I think it's time to see what other countries are doing. And you know, in Europe, they have mixed systems in which access to care is way faster and better access as well to quality services.
Yeah, but I guess, you know, and I'm sure you understand the resistance to it. There'll always be people who say it is not fair that because somebody has money, they should somehow get access to medical care when somebody who doesn't have the money with the same problems should not. And what do you respond to that?
Well, this fear is mistaken. I was referring to Europe. They have mixed system, but, you know, those systems are universal. We're not talking about two-tier systems in which the rich get faster access to care and the poor are left aside. And we tend to believe that in Canada we don't have a two-tier system. But as we speak, because of a rationing of care, well, some people, because of their connections, they're able to avoid long queues. And so I think we need to see what reform we should implement. And Europe is obviously, I mean, in France and Germany,
but
those systems are.
It's curious that because you know, you call it two systems that can cohabit and live side by side, and there's a confusion between that and the two-tier system. Yeah. So what is the difference? Is it just semantics, or is it more than that?
I think the confusion comes from the fact that we think that people in systems in which you have a diversity of providers, if you go to the private sector, you're going to have to take out your credit card and pay with your own resources. But it's not like that. You know, the financing of the system can be entirely public, but you should have freedom of choice for patients. So people can decide whether they want to go to a private clinic, get their treatment over there. Others could go to the public system.
And it would still be fair.
It will be fair, and as long as everyone is covered. And, you know, in Europe, it's the way it works. We often tend to believe that it's going to be like the U.S. system, but the U.S. system is not universal. In Europe, you have universal system, and you have competition between providers. And it's the main difference because, you know, if providers compete to attract patients, they will have to offer a good quality service and faster access to those treatments.
It's an interesting debate. It'll be interesting to see what happens with this legal challenge in British Columbia. Yeah. Thank you so much for coming in. And your study would be available on the Montreal Economic Institute website. A lot of interesting studies on that. So thank you so much for coming in.
Thank you.
We'll be right back.